Can you all hear me? Okay. So we'll now hear the perspectives from industry. And our first speaker is Doran Comaniciu, who is Senior Vice President of Artificial Intelligence and Digital Innovation at Siemens Healthineers. Doran.
Thank you so much. Great pleasure to be here and speak about integrated diagnostics from patient twinning, meaning digitalization and sensing of the patient, to precision therapy. My main disclosure is that I'm from Siemens Healthineers. This is a view of our company. We have in the world about 700,000 devices, starting from image scanners and moving to lab diagnostics, also increasingly pathology. And then we also cover therapy, such as radiation therapy and, for example, interventional oncology. Quite a bit of focus on cancer, on expanding cancer care, and I'm very, very passionate on how to improve care, but also expand care to many people in need. So now, when you look at these devices, we have something like 240,000 patient touch points per hour. Yeah? So now, think about, my talk is 10 minutes. 10 minutes, 40,000 patient touch points. A lot of data, and we have seen so many studies referred to today in hundreds. And the main question for data integration is that how do we make sure that we take advantage of so much data that is being generated in the world? And of course, that AI has a lot of opportunity there. Now, 8 billion people last year, November 15, 2022 in the world. We see the demographics changing rapidly, quite a number of people in the world, more and more people, but at the same time, global medical staff shortage. In the last couple of years, this is the main message. World will be short of 18 million healthcare workers by 2030. On the other hand, we see trends like exponential increase in computational power, exponential increase in the bandwidth. So our expectation is that automation will and has to increase in delivering healthcare. Now, about computational power, we referred to, there was a couple of discussions here, there were a couple of discussions. This is our experience. You see the graph, it's logarithmic scale versus the time. Our experience is that computational power, centralized computational power, has increased 1,000 times in 8 years. Now, again, if we refer to 2030, that means 1,000 times more compared to where we are today. So now in 2030, we're talking about something like a 1 zeta flop. 1 zeta is 1 million of millions of billions of operations per second. Now, that's the orange line. The blue line, equally important. The blue line is what is low-cost computational power. Low cost that is available at the patient's bed, that is available in our machines, that is available near the clinician's desk. So now the main question is that how this computational power, and in addition to everything that is developing, will influence medicine. Yeah. So now I want to show to you what does it mean when we put together computational power and also data. So this is the first experiment that was reported by our lab, actually, self-supervised learning with 100 million medical images. Now, if you take 10 seconds to look at each image, you need 35 years. If you take the time over a break over the weekend and only 8 hours a day, you need 100 years, right? So now the machine learns about this in a what we call self-supervised way. Is more like the way infants are learning. You end up with very large libraries, very similar to large language models that we talk about today. And now you can take these models and you can distill them downstream for various purposes, and ultimately you end up with improved accuracy, accelerated training, and higher robustness. So you should keep in mind that there is an important trend here of ingesting more and more data. And actually we're running now an experiment with 500 million medical images, and now we're introducing more and more knowledge from books, more and more knowledge, medical knowledge. So coming back to the topic, integrated diagnostics. The message is that, the first message is that one workspace, and this is very similar to what Mitch has shown as diagnostic cockpit, right? You have in front of you, you talk about harmonized UI, about case summarization, longitudinal patient view, AI-supported reading, various visualization, reporting, but also we can think in the future of having virtual assistants that you can ask questions about the patient. And then, of course, the research topics. For the interest of time, today I will talk about accessing clinical information, AI, and also the research and innovation. So let's stand back a bit, and I think. We are dealing with very high complexity. Human body is extremely complex, right? So up to now, the approach has been in structuring. We structure everything, right, with the purpose of integration. I believe that the paradigm is changing. We'll have now more and more capability to access data on the fly, to ask questions on the fly rather than structuring. And this is very similar how the web is working today, where the web is not structured. Actually, we're asked questions, right? And that's the same paradigm that is changing. The large language models, and don't think of what's happening today, but what's coming, is that it's a new paradigm where you can have the models to help connectivity and access, have the interpretation support, and also help synthesize and summarize the case. More than that, what we can have is that assistants that we can ask questions. So let's see how such assistant is working.
Indication?
The indication for this exam is CT follow-up after HCC treatment.
Can you give me additional information about the HCC extent?
Patient was diagnosed with hepatocellular carcinoma in 2020. There was a 3 centimeters lesion in segment 8.
How was it treated?
Patient received radiofrequency ablation.
Were there any additional lesions?
Yes, there was one 9 millimeters hemangioma found in segment 2 in 2020. There are also 3 cysts present. One is segment 4 with 6 millimeters diameter and 2 in segment 7 with 9 millimeters and 10 millimeters in diameter.
Now, moving forward, the second topic is about AI-powered diagnostics for oncology. Quite a number of developments, systems becoming better and better, looking at the oncology risk prediction, looking at the brain tumor analysis and metastasis detection and tracking, lung cancer screening, pulmonary lesions, breast cancer screening, prostate MR, analysis of the cardiotoxicity on the heart, and so on and so forth. And so on. So pretty much all these systems, they are a combination of imaging, patient data, and many times of pathology. When we talk about pathology, as you have seen in a very nice examples, is about going deeper. Is pathology is bringing together proteomics, metabolomic profile of the tumor, and genomics. So I'm very convinced of the more work needs to be done in the tumor fingerprinting, in what is the current fingerprint of the tumor, and how is it changing during the treatment. Cancer is such a dynamic disease. For radiation therapy, we have work that looks into who is responding to radiation therapy. Again, it's about fingerprinting. It's about looking into imaging patient information. It's about the tumor profile. And actually, we have a deep profiler that stratifies patients into the responders and non-responders, and ultimately go into dose prescription. And we work with multiple institutions to say whatever is being developed here, for example, in Cleveland Clinic, has worked at a different institution. And finally, again, when we think a bit in the future, things are not only about the statistical characterization of the information, but also how things are working, the mechanistic view, the generative view. And I hope that one day we will reach to what we call health digital twin, with everything that we talk about today, development of the computational power, with the flows of data. Ultimately, one can imagine one day that we'll have our information integrated from birth into a lifelong, personalized physiological model that is updated with each scan and exam. And ultimately, you have systems looking at us. And I also have a version of the digital twin that speaks and talks to me, right? And ultimately, we all want to live a longer, happier, and there is one more thing, longer, happier, and healthier life, right? And ultimately, when disease happens, then you have the information about you that can be used together with other information flows from the available treatments, from the everything that you can do in the simulation to select the best treatment and guide the best treatment for you. So thank you so much.